Pediatric exercise testing may be used for evaluation of various disorders of cardiac rhythm rather than for inducible ischemia as in adults. In a child with suspected sinus node dysfunction, chronotropic incompetence from sinus node dysfunction can be assessed by exercise testing. Evaluation of escape rates and ventricular ectopy with exercise in complete heart block is an important aspect in the evaluation of congenital complete heart block. ECG showing congenital complete heart block with ventricular rate of 47 per minute and atrial rate of 63 per minute. In stage 1 of Bruce protocol, the atrial rate has increased to 100 per minute and ventricular rate to 60 per minute. Tracing at peak exercise shows an atrial rate of 150 per minute and ventricular rate of 83 per minute. Increase in artifacts is visible on comparing the raw rhythm at the bottom of the image. Another situation in which exercise test is useful in children is when they have accessory conduction pathways in a condition known as WPW syndrome, Wolff-Parkinson-White syndrome. This produces early activation of the lower chambers as they act as bypass tracks, bypassing the normal delay of signals in the AV node. Accessory pathway conduction can be blocked during exercise. The heart rate at which the block of conduction occurs is important while making treatment decisions. If the early activation of the ventricles disappears in response to exercise, they are thought to have lower risk of very fast rates if a condition known as atrial fibrillation occurs. Atrial fibrillation is a fast, irregular rhythm from the upper chambers. In normal persons, most of the signals from upper chambers get blocked at the AV node so that ventricular rate does not go very high. But in WPW syndrome, they can get conducted down the accessory pathway and cause dangerously high rates in the ventricles. Congenital long QT syndrome is another condition in which exercise testing is useful. Congenital long QT syndrome is a disease with high risk of dangerous heart rhythm abnormalities arising from the ventricles. They have a prolonged QT interval on ECG. Normally, QT interval shortens with exercise, but it may not do so in some types of congenital long QT syndrome. Those with some types of congenital long QT syndrome and another condition known as catecholaminergic polymorphic ventricular tachycardia (CPVT) may develop dangerous fast rhythms from the ventricles during exercise. This ECG shows fast rhythm from the ventricles known as ventricular tachycardia occurring during exercise. This ECG during recovery from exercise shows that the ventricular tachycardia has subsided, but irregular beats are being fired from the ventricles, showing persistent irritability of the ventricles. Though treadmill exercise produces higher peak heart rates, better quality ECG can be recorded with bicycle exercise because of lesser body motion, which could produce baseline shifts and other artifacts. Maximal oxygen uptake is about 10% higher with treadmill exercise than a bicycle ergometer. Bicycle ergometer is an equipment using a static bicycle for exercise testing. An advantage of treadmill is that most people are familiar with walking or running, including young children. But exercise on a treadmill is not a natural form of walking or running for a person not familiar with exercise on a moving surface. Hence, time for practice on the treadmill should be provided before testing.